2, know the basic anatomy and associated terminology of the dog and cat. Unit VCS 05. Reproductive system of the cat and dog. We'll break this down into the male and female system, starting with the female. The function of the female system is to produce eggs, or ova, the hope being that they will be successfully fertilised. The fertilised eggs will travel to the uterus where it will implant and grow. The female system consists of the following parts: ovaries, fallopian tubes, the uterus, vagina and vulva. The ovary and reproductive tract. At birth, the ovary contains all the germ cells that an animal will ever need. This acts as a reservoir from which the primary follicles will develop. At the time of sexual maturity, several primary follicles develop what we call ripe Graafian follicles. In multiparous species, there will be many follicles divided between the two ovaries, and when we use the term multiparous, that means that they can give birth to multiple offspring. The Graafian follicle secretes the hormone estrogen, and upon reaching the full size, the follicle will rupture, thus releasing the ovum or the egg, and this is a process that we know as ovulation. The ovary and reproductive tract. During ovulation, the ovum travels down the uterine tube. Other remaining follicles become reorganised to form the corpus luteum, and that secretes the hormone progesterone. Within the reproductive tract, the uterine walls become thickened and more glandular, thus creating an appropriate environment for the implantation of the fertilised ova, if that is the case. The vaginal epithelium also changes, producing the blood-stained discharge that would be seen in the proestrous stage of the bitch's cycle. A little bit of relevant terminology here for you. We term the canine female as the bitch, the feline female as the queen, and the reproductive tracts of both are similar, but are going to vary quite differently in size. Consider the size difference between a cat and a Labrador, and that will give you a good idea. And this is something that you will very quickly see in your time in veterinary practice, and get familiar with the differences in such size and what we should expect. The tract of both these animals is designed to carry several fetuses during a single pregnancy, and is said to be what we call biconcornate. So we have two uterine horns, as we can see in the image provided. And the bitch and queen are said to be multiparous, meaning that they have litters. That means they have multiple offspring, not just one. The image provided shows the setup of the female reproductive tract. The ovaries. These can also be termed as the female gonads. They have two functions: to produce ova, or eggs, ready for them to be fertilised by the sperm of the male animal. Also act as an endocrine gland, secreting the hormones estrogen and progesterone. They are paired with one sitting either side of the dorsal abdomen, and they are caudal to the kidney. The ovary is held in place close to the kidney by the ovarian ligament, which is a suspensory ligament. The fallopian tubes, also known as the oviduct or uterine tubes. They function to collect the ova as they are released from the Graafian follicles, to transport the ova from the ovaries to the uterine horns, and to provide the correct environment for the survival of both the ova and the sperm. The open end is funnel-shaped, and we term this as the infundibulum, fringed by little finger-like processes that we term fimbriae. The fallopian tubes. The ova pass down the lumen of the tubes. They are lined with ciliated columnar epithelium, and the cilia help to propel the ova along the tube towards the uterine horns. The uterus is a Y-shaped structure lying in the midline dorsal abdomen. However, during pregnancy, the weight of the pregnancy would pull the uterus ventrally. The function of the uterus is act as a receptacle in which embryos can develop into fully developed and full-term fetuses, to provide the appropriate environment for the survival of the embryos, and to provide the means of providing the developing embryos with essential aspects they require, such as enabling them to receive nutrients from the dam. And this is made possible by the uterus. We can divide the uterus into two parts: a pair of uterine horns that lead from the uterine tubes, and the body of the uterus, which is a short central connecting duct for both uterine horns. Uterine walls. The walls of the uterus have three layers: the endometrium, which is the lining of columnar mucous membrane, glandular tissue and blood vessels. During pregnancy it thickens to provide nutrition for the embryo prior to implantation and to support placental development. The myometrium. These are layers of smooth muscle which produce strong contractions during parturition. And the mesometrium, also known as the broad ligament, and this is a fold of visceral peritoneum, and this suspends the uterus from the dorsal body wall. The cervix is a relatively short, thick-walled muscular sphincter which connects the uterine body with the vagina. It is usually tightly closed and relaxes to allow sperm or fetuses to pass. During pregnancy, a mucoid plug that blocks the canal, protecting fetuses from infection. In a non-pregnant animal, the cervix lies in the pelvic cavity, but during pregnancy, the weight of the fetus pulls the cervix cranially and then ventrally over the edge of the pelvic bridge. The vagina and vestibule forms a channel leading to the external opening, the vulva. The vagina leads from the cervix to the external urethral orifice, and this is the point where the urethra joins the reproductive tract. The vestibule leads from the external urethral orifice to the vulva, and it is shared by the reproductive and urinary tracts. The lumen is lined with stratified squamous epithelium. The epithelium is folded in a longitudinal manner to allow for widthways expansion during parturition and is surrounded by layers of smooth muscle. The smooth muscle is very strong and during mating will maintain the tie. The vulva is the external opening of the female urogenital tract, and it is made up of two parts. The labia. There are two vertical lips joined dorsally and ventrally, and the space between them is known as the vulval cleft. During proestrus and estrus, within the estrous cycle in the bitch, the labia enlarge, which is not seen so commonly in the queen. The clitoris is a knob-like structure made of erectile tissue that sits in the clitoral fossa inside the ventral angle of the vulval cleft, and this is the equivalent of the penis. The estrous cycle of the bitch. They are termed seasonally monoestrous. This means they will have one fertile period or season within a period of time. Most bitches come into season in the spring and autumn, however this may not be the case with all breeds. Puberty and the reaching of this will alter depending on the breed of the bitch. A general rule of thumb is that the smaller the breed, they will reach puberty quicker and have their first season at between the age of 9 to 12 months, whereas larger breeds may not have their first season until they are around 24 months of age. There are 4 stages that make up their estrous cycle. The estrous cycle stages. The stages are proestrus, estrus, metestrus, but may also be called diestrus, and anestrus. And when we use the term heteroseason, we are describing 2 of the above stages, proestrus and estrus. When discussing the relevant stages, we need to consider the length and duration of the stage, the behavioural signs associated that the animal will display, the clinical signs that will be displayed, and the actions of the relevant hormones. There is an associated task for you to complete within the associated handout. Please produce this and upload for your veterinary educationist to mark. Ovulation in the bitch. The eggs develop in the ovary. The hormone termed follicle stimulating hormone, or FSH, will stimulate the growth of these eggs. They each develop in a fluid-filled follicle, and we term this the Graafian follicle. The wall of the follicle secretes the hormone estrogen. Estrogen will make the bitch show signs of being in season and will prepare the genital tract ready for mating. When the egg reaches maturity, we have a rapid surge of a hormone that we call luteinizing hormone, or LH, and this surge will cause the follicle to rupture and cause the egg to be released from the ovary and travel towards the fallopian tube. After ovulation has taken place, the empty follicle develops into a solid format or structure, and we term this the corpus luteum. This in turn produces the hormone estrogen, and that is responsible for maintaining pregnancy should any mating that takes place be successful. The estrous cycle of the queen. We term the queen as being seasonally polyestrous. This means that it will have many fertile periods or seasons within a period of time. They usually cycle every 2 to 3 weeks, and this takes place in spring, summer and autumn. This is related to the longer daylight hours and warmer periods of time within the seasons. Again, puberty can vary in the queen, however it is quite normal for them to have their first season between 5 and 9 months of age. There are 4 stages that make up the queen's estrous cycle: proestrus, estrus, interestrus and anestrus. Now please again complete the adjoining task within the adjoining handout for your veterinary educationalist to mark. Ovulation in the queen. Termed as induced ovulators. They will be induced by mating taking place, and this is due to the anatomy of the male tomcat. During mating, thus causing ovulation. This is due to stimulation occurring from the barbs or spines of the male's penis. This causes a surge of the luteinizing hormone, and it is this surge that will cause ovulation to occur. Once ovulation and successful fertilization have taken place, progesterone hormone will be released from the corpus luteum to maintain the pregnancy. The male reproductive system is comprised of the testicles, epididymis, deferent ducts, spermatic cords, urethra, penis, prostate gland and the bulbourethral gland. The image provided shows you the structure of the testicle. Male species differences. The 2 images provided show you the differences in relation to the canine and feline in relation to position of the male reproductive organs. The testes. The male gonad. Its functions are to produce sperm or spermatozoa by the process of spermatogenesis to enable the fertilization of the ova, to produce a small amount of fluid to transport the sperm from the testes into the female and aid their survival on their journey, and to secrete the hormone testosterone as this influences spermatogenesis. The testes. Found in a pair outside of the abdomen in a sac-like structure known as the scrotum. The scrotum keeps the testicles at a temperature lower than the body temperature, and this is optimum to sperm production or spermatogenesis. Internally, the sac is divided into 2, each aspect containing 1 testes. A testicle is an oval-shaped gland wrapped in a double layer of peritoneum that we call the tunica vaginalis. The testicular tissue consists of numerous numbers of blind-ending tubules, termed the seminiferous tubules. The testes. The seminiferous tubules are lined by 2 types of cells. Spermatogenic cells divided by meiosis to produce immature sperm or spermatids. Each spermatid will contain the haploid number of chromosomes. The Sertoli cells. They secrete estrogen and nutrients in order to prolong the lifespan of the sperm. Testes. Lying between the tubules are the cells of Leydig, or interstitial cells. These secrete testosterone and are under control of interstitial cells stimulating hormone. This is produced by the anterior pituitary gland. The coiled seminiferous tubules make up most of the testicular tissue and will eventually become combined to larger efferent ducts. These ducts in turn drain into the epididymis lying along the dorsolateral border of the testes. The descent of the testes. As each testes and all its associated aspects, including blood capillaries, nerve, and deferent duct, passes through the canal into the scrotum, it becomes wrapped in the tunica vaginalis, the double fold of peritoneum. The testes begin their descent into the scrotum during the early stages of neonatal life, and failure of the testes to descend appropriately is termed cryptorganism. They may remain in the abdomen or within the inguinal canal where they are initially situated. The deferent duct. The epididymis continues as the deferent duct. It passes out of the scrotum into the abdominal cavity via the inguinal canal within the spermatic cord, also known as the vas deferens or the ductus deferens. It is the connecting tube between the epididymis and the urethra, the terminal aspect on the neck of the bladder. The spermatic cord. This travels from the epididymis into the abdomen. Both the spermatic cord and the testicle are surrounded by the tunica vaginalis, and the cord has a number of features: the deferent duct, the testicular artery and vein, the lymphatic vessels, nerves, and also the cremaster muscle, which raises or lowers in relation to controlling temperature of the testes. The penis comprises of the highly vascular erectile tissue. Dogs have a visible penis on the ventral abdomen. It contains the os penis bone and is said to run from the ischial arch or pelvis, cranioventrally along the perineum between the hind limbs. As you saw within the picture in one of the earlier slides, the male cat actually has the penis being not visible in the same way as the dogs, and that showed to you how it was situated on the body. Found within the tissue of the gland penis is a tunnel-shaped bone termed the os penis. Its function is to aid entry into the female genitalia during the early stages of reproduction. It lies dorsal to the urethra, which runs through the tunnel in the bone, and at this point the urethra can't expand, so unfortunately this is a common site for urethral blockage. The distal part of the penis is contained within a sheath of hairy skin termed the prepuce, suspended from the ventral aspect of the abdominal wall, designed to cover and protect the penis. It's lined with mucous membrane. It's well supplied with lubricating glands, and during mating it is pushed back to reveal the gland's penis. After mating, the retractor penis muscle pulls the penis back into its normal position. Differences in the tomcat. Main parts are similar to that of the dog. The cat penis is however shorter and points backwards. They have a penis located under the tail, ventral to the anus. It is specially adapted to having barbs on the gland's penis which stimulate and induce the ovulation of the queen. The os penis lies ventral to the urethra in the cat. Accessory glands. These contribute towards the secretion of seminal fluid. They increase the volume of ejaculate to help the sperm passage into the female tract. They provide an appropriate environment for sperm survival. It helps to neutralise the acidity of urine within the urethra. And the most important accessory glands are the prostate gland, which is a single gland. In the dog, it is close to the neck of the bladder. The bulbourethral gland. These are paired glands located on either side of the urethra, cranial to the ischial arch, and these are found only in the tomcat. The image provided shows you the anatomy of a sperm cell. The male sex hormones. Testosterone produces secondary male characteristics, development of the reproductive tract, and influences spermatogenesis. The sperm formation follows this sequence. Testosterone stimulates sperm to be produced from the interstitial space in the cells of Leydig. This stimulates production of sperm from the spermatogenic cells in the seminiferous tubules. The secretion from the Sertoli cells in the seminiferous tubules help to nourish the sperm. The sperm will continue to grow, and when they reach maturity, they will detach themselves and travel to the epididymis.